Hi folks, I'm Bob Schrupp, physical therapist.
Brad Heineck, physical therapist.
Together we are the most famous physical therapists on the internet.
In our opinion, of course, Bob.
Glad you were chiming in there, Brad. Sometimes you get a little silent on me.
Well, it happens.
Okay, today, I don't know why I even said that. Today, Brad, we're going to talk about 10 causes of pain down your leg. A lot of people think automatically they get pain down their leg, they think I have sciatica.
Exactly.
I just had a patient like this. I think I'm getting sciatica down my leg.
Sure.
And actually, there's a lot of reasons you could be getting that pain, and we're going to go over them. There's 10 of them at least, and we're going to go over these so you can kind of maybe even somewhat assess it yourself.
Sure.
We'll give you a hand here.
Give you something to think about anyways.
Yeah. And I see, Brad, we have a couple new people that just wandered in here.
There's 3 out there, Bob.
Yeah, thanks for coming. If you are new to our channel, please take a second to subscribe to us. We provide videos on how to stay healthy, fit, pain-free, and we upload every day. Also, please like us on Facebook. We want to be liked.
Yeah.
So
yeah, we got that
complex.
Yeah, complex we need to get over. So
all right, today, Brad,
out.
let's talk about the first one. The first one that quite often causes pain down your leg is a simple hamstring injury. And you can see why that is, Brad. Hamstring attaches to your sit bone right here, and it goes down and attaches to below the knee.
Yep.
So you can see if you're getting pain down here, how that could easily cause a pain like sciatica, sending it down there, but it's not sciatica.
Yeah, it's a muscle injury.
So let's show you just one simple test, Brad, maybe with you sitting.
Yeah, sure.
So you can bring the leg up like this and then just have him push down.
Yeah, so just a muscle strength test.
Yep. I'm just
Make sure the person's sitting up with good posture. That'll be helpful. I'm going to pull my foot underneath the table as hard as I can.
Pull.
Oh, that hurts,
Yeah.
Bob.
So
that might be indicative it's a muscle.
Right.
And then maybe if we stretch it the other direction, I stay relaxed and give it a stretch once. Go ahead, Bob. And if that also hurts, as well as the pulling, that's also indicative.
Yeah, because you're stretching the hamstring.
Right.
So,
but you want to have good posture that you don't want to be slumped over because that gets confused with another test we're going to come into just a little bit.
which one? We do that next, Brad.
Okay, then, say no more.
The next one is a herniated disc. Now, this would be sciatica.
Right.
Okay? So you have a disc that's pushing on the sciatic nerve, or the nerve root, and it's sending pain down the sciatic nerve. And a very simple test for that is the straight leg raise test, which you can do it two ways. Probably the best is laying down, wouldn't you say?
Well, that's the way I always do it. There's one point I wanted to bring up. If it is a hamstring injury, almost always the pain is not going to go below the knee.
Right, good
point. It's going to stay
Very
from
good
the
point.
knee up. So that's another little clue. There's a lot of little clues. People, take some notes, people, if you're into this. Get your notepad out.
If it's not going below the knee, it still could be sciatica, but it's starting to think about other things that are possible. So why don't you lay flat, Brad, on your back. Sorry, no pillow.
I'm good at that. That's all right.
All right.
I feel good.
So very simple. You're just going to go ahead and the side that it hurts on, you just go ahead and lift it up like this. You got to have someone lift it up for you. You can go up to the point where you start to feel resistance, and now I bring it down just a hair, and then I go like this.
Whoa.
Now he's going to feel stretching here in the calf, but if he feels pain in his back and down the leg, now we're starting to think that might be a positive for a sciatica or herniated disc.
Right, and I've had people where I do this, and they say, I feel it right back here. And then you know it's related to the nerve one way or another. It's probably...
Yeah, and Brad, I'm sure you found this too, Brad, is a lot of times you just even go up this high.
Right. And chances are you're not going to go that high.
Yeah, you're not going to go that high. And then you'll find out you can go higher on the other side because that one's fine.
Exactly.
So,
compare one to the other.
Yeah, it's usually pretty evident right away if it's sciatica.
Do I have to get up?
You can get up now.
Oh, the rest. Okay.
Now this next one, Brad, is a little more difficult. It really takes more of a therapist to diagnose it, but sometimes after you've had a herniated disc and it's gone away, and you still might have some scarring on the sciatic nerve.
And it happens if you look here up in here typically, where that nerve comes up and it binds down, and that nerve, a healthy nerve needs to be able to move up and down slightly, and if it gets bound up, then that nerve gets stretched because it's hung up in that scarred area. So we need to break that scar tissue up. But the tests are a little complicated.
Yeah, a little bit beyond. What I would say is that a therapist would have to diagnose, and in that case, then you do what is called nerve flossing.
Sure.
Which, believe it or not, it sounds kind of funny, doesn't it?
Yeah.
Like you're flossing your teeth. But you're breaking up the scar tissue, so that's another possibility. And that is more of a sciatic problem. Was kind of a sciatica.
Right. That can, like after a back surgery and the person didn't rehab properly, that's a classic case of having that problem.
Another common cause of pain down the leg is stenosis. Now, this is very common. It's as the back starts to degenerate. There's less room for the spinal cord. There's less room for the nerves to come out the side. I don't know, do we need to show all that or not?
Well, actually, let's go on because we got to get through all 10.
Yeah, we got to get all through all 10. So, you know, one of the big signs of stenosis is it's called shopping cart syndrome. So if you're, or you could also use a walker to do it. But if your back feels and the leg pain feels a lot better leaning forward,
right?
That's generally this. That's the first question I ask people. You know, does it feel better when you're in the grocery store and you lean on the shopping cart? They go, yes. And it's worse when they stand up straight.
And when they sit down, it goes away quite quickly.
Right. That's the opposite of sciatica. Sciatica is usually worse sitting. You know what I mean? Well, because you get a herniated disc.
Exactly.
But stenosis, it's going to feel better sitting when you're flexed.
Yep, exactly.
So, all right, the next one, Brad, is regular old hip arthritis or hip pain can go down your leg. I mean, quite often you get it in the groin, down the inner thigh, down the back. I mean, there's just a lot of different ways you can be getting it.
And this, I don't think it's common, but I can think of one case where a patient had it all the way down to the foot.
Yeah.
And it was classic sciatica, and we worked on it because everyone thought it was from the back. The hip was bad too. And she ended up getting a hip replacement, took care of everything.
Wow.
These things aren't easy all the time.
Yeah, it's weird how much pain from arthritis, from like a joint, how far it can travel sometimes. I've seen it in shoulders too, go all the way down to the hand.
Yep.
When it was a shoulder issue.
It's called referral pain. It refers out, usually down following the nerve. That's why this is not easy. You know, that's why we do go to school for a little while.
I think the hip pain, a lot of times what you're going to see is, you know, if you especially only have it one side, you're going to see the one side does not move as well if it is arthritis.
Sure.
So like if you bring this one up, this one goes up this far, and this one only goes this far.
Right.
Or if you cross your legs, this one goes up way like this, and this one goes way down like that.
Sure.
You know, there's indicators. You can even do an internal rotation like that. So
again, the big thing is hip can refer down the leg and mimic sciatica.
Right. Next one is the IT band, Brad. If you have
IT. Does that
iliotibial band.
Oh, I thought it was IT like those computer people.
Yeah.
Yeah.
So what Brad's going to show you real quickly how to, how tight band. The band runs all the way from here all the way down to the knee.
Right.
So
it's the iliotibial. So we got the ilium, the tibia down here. Now to test this, we have someone lay on their side like this. Bob, can you scooch back to the edge of the table? You can do this on a bed, but it's much better on a firm surface
just
like
don't
this.
fall off.
So here, that band is represented by his clothing here, and if it's tight, it's like this, and it tightens up more.
A lot of times you hold right here, Brad, don't you?
Yeah, but I want.
You don't want to be in the way.
Yeah, I don't want to be in the way. So you put your hand there, like
right,
I would have my hand over there.
So I'm holding the pelvis.
And I'd be like this, but so you can see. Now, if it's not tight, the leg will drop
down.
way down. If you got a tight IT band,
you let go, it'll hang up right there.
And the nice thing about this, again, is flip the person over, test both sides, and see how they compare.
Yep. That IT band, though, it can give you a lot of pain down even in the knee, right in the knee area where it attaches. So.
Exactly.
Next one is the piriformis muscle, Brad. That's a small muscle in your butt.
The buttocks, Bob.
The buttocks,
yes.
And it can cross over the sciatica. It's actually called false sciatica sometimes because it can send pain all the way down your leg.
Oh, yeah.
But the muscle crosses over. Sometimes the sciatic nerve actually pierces through it.
Sure.
And I'm going to show you just a quick test for that, Brad.
Sure.
In fact, there's two usually. One, if you like, let's say the pain is on this side, Brad. Generally, if you bring the knee up and cross it over.
So like your right knee is going towards your left shoulder.
It's going to feel real tight, and it may even hurt a little bit. Compare it to the other side, and that one should be better.
Right.
That's how it is with a piriformis muscle. The other thing you can do is you can actually get yourself in what we call the clamshell position here, knees together like this, and you do these.
Yep.
And if you do a repetitive of these and it starts hurting down the leg,
Yep.
you're putting pressure on that piriformis muscle. It is an external rotator.
Sure.
So
That's one of those subtle little ones that kind of
Right.
you can test. Yep.
next one, sacroiliac, Brad. Do you want to pull the spine out here?
Boy, you're getting a workout today, Leopold, whatever. Let's take a look at that sacral. This is the sacrum, the ilium. So they got a SI joint here and one right here. Solid bone right there. But that joint
that
is...
can send pain down your leg and into the groin
Right.
and a lot of different ways.
Rule of thumb that I've always heard and go with is it doesn't go past the knee
No,
typically from
I
the
don't
SI.
think I've seen an SI go back past the knee.
Yep.
I see it a lot of times in the front thigh and that area here. One simple test for the SI, Brad, is just to lay down, cross the leg over like this. You push down here and push down here.
One hand there.
And here.
Gently push,
gently.
don't push too hard.
And a lot of times that puts pressure on the SI and it'll hurt on that side. Next one, if you have arthritis in your back, believe it or not, that can send pain down your leg.
Sure.
Just plain old arthritis. And it can go, but generally that will not go past the knees either. So,
You know, if that's developing into, that kind of arthritis could develop into stenosis.
right.
And so these things tie together. It's just not, that's what makes it a little more challenging, but you know, that's the way it is.
The last one I mentioned, Brad, is knee pain. Sometimes knee can refer up. It tends to refer down. But I don't know that I've ever seen a case that was real bad that went up. I mean, I've seen it, and we almost always knew it was the knee.
Right.
Yeah. I
But
think that's more of a rare one, but you do read about it.
well, we needed a 10th one.
Yeah, we
anyways.
needed a 10th one, so we kind of stretched a little bit on that one.
It's possible.
All right, thanks.
But you're never going to get referral pain down the leg from the broken
Yeah.
heart syndrome.
Remember, Brad and I can fix just about anything,
But the broken heart.
but we are working on it.
We're not going to give up.
Thanks for watching.